Welcome to the second video in a series where we're talking about the US healthcare system, what it is currently and how it got here, and kind of forging a path all together where we can maybe crowdsource a solution because it's a hot mess. In the first video, I will leave it linked down below if you want to go check that one out. We just went over the history of it. Like, how did we get here? Why are we the country that seemingly all the other countries have a single payer system? How did we end up with ours, which is more of a for-profit, what would you call it? Like a capitalism something?
Yeah.
Yes. System, and what we're doing. So today we're going to take a more human approach. So if you are new here, I'm Liz, I'm a family nurse practitioner, and I am, if you've watched my channel at all, I am like a liberal human. I wanted to bring in, I didn't want this to be a political only thing, so I have found a convenient conservative person who I'm related to and dragged her here. And I was like, let's have a different side of the conversation just to show that it is a people issue. This is not a political issue. So I have brought my sister. This is Rachel. She has had quite an extensive, she's the perfect guinea pig because she is much more conservative leaning politically. And she's experienced a lot in the healthcare system. And she's also been in like every single type of insurance you can possibly be in her short life. So we're just going to sit down. I thought it would be good to have a dialogue just to show everyone. You know, I shared some of my experience before. I'll share other people's stories. If you go to the comments of my last video, there's a ton of stories of just saying that our system is not working. Because I think first, before you can solve a problem, you need to really see it. And I think you're a good example where you can really see like, wow, this affects so many people. I know like her situation really opened up the eyes of a lot of people within my own family. They're like, oh, this is more of a hot mess than you really necessarily thought. Because sometimes if you don't see it, it's just not a problem, but it is a problem. Would you say that's accurate of kind of what you wanted to express here?
Yeah, and definitely it was more eye-opening for our parents because at first our parents were very much like, oh, you know, socialism and Russia and, you know, all that stuff because they're, you know, they've never had to experience it. And then when I was having all my problems, my mom was the one who was getting her hackles raised and being like, why is this the way it is? And I was like, I don't know, Mom, good question.
Yeah. So this is kind of just to give an example from someone else's perspective who does not have my, you know, because I never want this to be like totally blown off because of what I feel politically. So I wanted to kind of bring in a different person to round out the conversation and give you an example of what's going on. So if you would like to also share what you've experienced in the healthcare system, feel free to leave those comments down below. I think the more we can realize like this is your neighbor. These are all of our neighbors. These are our sisters, our aunts, like everyone is so affected by this. And it's not just like someone else's problem. You know what I mean? Like this became really personal to me when I had my daughter because she was very expensive at like $13,000.
Bargain baby, pricey baby.
Yeah. And if you haven't been touched by it, I think it's easy to make it not your problem, but this is hopefully to just expand your view of that so that I can make it your problem too, and you can be just as mad as me. It should be the tagline of this whole thing. Please get angry with me.
No. When we were talking about like maybe doing a podcast, and I sent it to my friend who does podcasts, and she listened to it. She's like, yeah, this would make a great podcast. By the way, I'm now really angry about this. And I was like, hey!
Sorry, so we're going to make a podcast and we're going to call it Just As Mad As Me. All right, perfect. Okay, so would you like to just dive in? We have notes just to keep us on track. Did I say you're my sister?
Yeah.
So we're going to really try to stick to the train track. We're going to try to go. Would you like to just introduce yourself and say who you are and then kind of go a little bit through your story?
Okay. I'm Rachel. I'm usually behind the camera editing and making snide comments. I tend to work in more creative jobs. So it's not like I'm not the person who's like, you know, going into a science field, going into engineering or like something that's going to generally pay a lot more. I've always been in more of the low paying jobs because, you know, I've worked in journalism or I've worked in publishing, like things that aren't
necessarily as societally valued as much, which is stupid. But you've also never worked in healthcare, so I think you've never, like, I've seen this a lot at work, but you've never worked in a field where, I mean, your coworkers might have complained about healthcare, but it's not like your daily interactions weren't with people dealing with healthcare.
And it was actually like interesting because I got to see a lot of people who, because only one of my jobs offered health insurance through the company. And so it was interesting to see what other people's insurance situation was like. But yeah. Oh, and I also wanted to make it very clear that I'm not just going to complain about bad insurance. I've had fabulous insurance and I've had bad insurance. So it's like the system works. It just doesn't work all the time.
And it works for people who are in a certain position in order to be able to afford it.
Yes.
Yeah. So, and it's not necessarily anything like you didn't work less hard when you had the really good insurance. It was just your life circumstances were different, kind of like that. So what was your first, so we started out, like she said, my parents have always had fairly good insurance provided to them through their employer. So growing up, this was not something that like you or I felt like when we needed healthcare, we had it. And it wasn't something that I was even aware was a problem. I don't know if you feel the same. Like,
yeah,
I was not aware of, I mean, we were very privileged in that I was just clueless that some people, very, very lucky that this was just not something on our radar.
Yeah, like, so when I got my first job, my first, like, real job out of college, I aged out in December when I turned 26, and then that February I got a job. But in the middle, it was like, oh, crap, I don't have health insurance anymore. And so we had to go onto the website to get the insurance because at the time I was unemployed.
And that's like that.
So Pennsylvania has, and we had no idea what we were doing, which was funny because, like, I had Liz and we were constantly like, Liz, what do I do? And Liz is like, well, I don't know.
Yeah.
And so, like, as a healthcare provider, she had no idea how to use the marketplace.
Which is also another huge issue is providers you don't learn anything about that in schools, but that's a different tangent for a different day.
And my mom, who's also has, you know, like 30 years nursing experience, she had no idea. And my dad, who is like an executive in a company, he had no idea. And I was like, this is good. So having to figure that out was less than fun. And then we figured out, oh, when you have to get Medicaid, because I was unemployed, so I was below the poverty line, you have to have a caseworker. Nowhere was it clear that you have to have a caseworker to get on Medicaid. And no one in our family had ever had to do that before. So then it was, I can't even get insurance because I now have to go get a social worker. And that is, again, another tangent for another day. But eventually, you know, I did get on Medicaid, and it is alarmingly good. After, this is something that'll come out in a later video, after the Affordable Care Act was implemented, Medicaid had to either choose to stay the same or expand, and in Pennsylvania, it did in fact expand. I didn't pay anything to go to the doctors. I didn't pay anything to go to the insurance, or a specialist, although there was, like, you know, boxes we had to tick if I was going to go to a specialist. I got all my prescriptions for free, which was great. And so, you know, I mean, it sucked, you know, being unemployed, not making any money, but I did at least have health coverage. And then, so when I got my job, at first it was okay because I was working part-time for them at first, and they were paying me like something really stupid, like $9 an hour or something.
Oh, gosh.
Yeah, I never got paid more than $12 an hour there. And initially, I was like, okay, that's fine. I'm going to be able to stay on my Medicaid. And then they wanted to bring me up to full-time, but they weren't willing to raise my hourly rate. But the thing with Medicaid is you have to monthly stay under a certain amount of money. In this case, it was $1,300, I want to say.
Which is nothing.
Which is not a lot.
No.
But the thing was, I was making about $100 over that if I went to full-time. And as soon as I went up to full-time, my health insurance cost per month bumped up to, I think it was like $600 for my plan that would cover my, like, let me get, it wasn't like a great plan. It was, you know, you can have your annual visits. You'll have like a $60 copay to see your doctor. And then if you need to go to a specialist, it's like $100. My prescriptions were actually were pretty well taken care of. But it was a very expensive plan, and even with tax credits, I still paid about $375 a month.
Which, when you're bringing in what you did, that's like a significant. Yeah.
Exactly. So I went to the HR at my company, was like, look, I need to make more, or I cannot come to work full time because I will lose my health insurance. Mm-hmm. I cannot afford to pay this. Mm-hmm. And they brought me up to $12 an hour to work full time. And that still was, it didn't give me a lot of wiggle room, but something that is a recurring story for Liz and I is we are very lucky in that I was living with my parents. They were charging me like $100 of rent, and I had to shove it at my mother and be like, take it. I didn't have a lot of bills, so I was okay. But it was still like...
But so many people, that's
so
not
many
the
people,
situation.
that's not their story.
And that's what I saw all the time. I saw that all the time at work with people who then were facing, do I quit my job in order to keep my health insurance and the health insurance that I have for my children? Or do I work? But if I work, I actually can't afford health insurance. And they fall in between this gap of, because that's such a low threshold for how much money you have to make before you can drop out and you can't qualify for Medicaid.
I called it low income and then not low income enough.
Yeah, it's just not enough to live if you don't, it's not doable. So that's a huge spot that people initially fall into, and so you kind of fell into that first hole.
Yeah.
Did you find that it was really difficult to find providers when you were using Medicaid, or took people who took your Medicaid insurance?
For general was not hard. If I had to go see a specialist, if I had to see an orthopedist, they were less than thrilled, I would say. And even primary care, they didn't seem happy.
Yeah, and we'll have a whole video at some point. We're going to do one on the Affordable Care Act. I'll do one on why are doctors' offices less likely to want to take you as a patient if you have Medicaid, because that's a whole other thing. And so we're going to go into all that. So we'll skip over it today. But if you would like to kind of learn more about that, just make sure to subscribe, and we will. All of those are kind of coming out because we're doing a deep dive into the world of what is this disaster. Okay. Roll right along.
Rolling right along. There were other issues with this job. And I did not stay there long. I stayed there 9 months. And then I left. And I was back on Medicaid. But this time I was going back on Medicaid as a freelancer. And I was like, I'm going to be a freelance editor. When you are an independent contractor, and you're trying to get on Medicaid, this is where my social worker and I came to cuffs. Because it's very, very hard. Because one, they need you to prove annually what you make, because that's when it moves from monthly to annually. Because as an independent contractor, you don't have a set amount you make every month. And they were like, well, you have to provide your annual, what you made as a freelancer. And I was like, well, it's my first year. I don't have history of this. And so they didn't want me to, they wanted to deny me Medicaid. And I'm like, but I'm also not making any money. They're like, yeah, but you can't prove that you're actually working. And I'm like, but I am. I just don't have a history of it yet. Yeah. So that was a whole other complication. But I did end up getting it. And, that aside, that's not really a problem with health insurance. That's a problem with...
Well, it just points out another hole in the system of it's very difficult to start your own business if you're under this type of a health insurance system, or branch out and do something creative, or you have to tying your job with insurance just creates a whole, it's horrible for any kind of creativity, anyone who wants to start their own business, because then they also have to pay for their health insurance. And if they want to bring on other people, they have to compensate them for that as well. Versus, a system where you can choose your job based on what you like versus your health insurance.
Yeah, it was fun. But eventually I got tired of that. So I went to work at a indie comic publisher. And it was kind of funny when you did the first video, when it was health insurance incentivized you working here. It went back to that because it was a small company. They couldn't offer a lot in forms of they didn't offer anything like retirement or anything. Salaries were a little bit more conservative, but they're like, hey, you don't pay anything towards your health insurance. You don't pay anything towards your dental insurance, towards your vision. And it was actually a really good plan. It was $80 for a specialist, $40 for a regular visit. My prescriptions, the most expensive one I had was $25. So it was a good plan.
Mm-hmm. So it worked in that way, that it worked. It lured talented people in via, which is kind of how it originally started.
Exactly. Mm-hmm. And the only problem was, which I thought was interesting because it never occurred to me before, with most jobs, you have a probation period. and I had a 3-month probation period. But the thing was, they were like, well, we can't offer you the insurance until after their probation period. And I was like, well, that's weird.
Better not die.
But then, as I talked to more people, it was like, no, this is pretty standard. And I was like, oh, okay. So normally I don't know, because I've never worked in a normal job, I guess. I don't know what the provisions are for that. But since I was coming off of Medicaid, if I had been on a regular, like the insurance plan I have now, I could have kept paying monthly and I would have had that gap bridged.
Where
but
you
I
can
was
kind of like Cobra it.
Yeah.
Yeah, and get through. I mean, it's very expensive, but it's doable.
But you can do it. But I was coming from Medicaid. And Medicaid said, well, you're getting paid.
Yeah.
I was like, yes.
So it's just like a trap.
I am, but I don't have insurance. And they're like, well, you can't get Medicaid. And I was like, fine. Can I buy insurance for these 3 months? And I went to my social work, my caseworker, and they're like, you can't do that because it's considered health insurance fraud. Because a lot of what basically happens in the system is people will buy insurance to cover something big, like a surgery, and then they stop paying their insurance. They're like, so that's insurance fraud. I'm like, but I can't do that. And so I went 3 months without any health insurance, and it caused a fair amount of problems.
A ton of people fall into that too. Like I had a ton of patients who would come in and they haven't had care because, they had been on, let's just say you've been on medications for your high blood pressure, and now you lost insurance because it's very easy to lose insurance, as we've kind of been highlighting. And then now the problem is so much bigger. Now your kidneys have damage. Now you already have all sorts of disease in your arteries and veins, that's going to put you at risk for a heart attack and stroke because you had this weird gap year where things were just bad and you were stressed on top of it. It's just so easy to lose insurance, and then there's no gap. If you are on medication for your mental health, and that's just gone. It's just, it's very easy to fall through the cracks.
Yeah. And it does end up costing more money in the long run because thankfully I didn't have any medical problems from that gap. But
you would be bankrupt. If you had gone, if you had to be hospitalized.
So then I was there for 2 years, and then an opportunity came up to work for my sister. And that came up with, okay, well, we're establishing an LLC. And then the question was, well, do I buy my insurance or does she provide it? So then that was very interesting because we were looking at the employer side of it. And it is very, very expensive to provide insurance as an employer. So I can see why, there's not, why small companies, that's why I'm amazed that my last job provided it, because I was like, it's a lot. It's a lot of money and it's very complicated. So we decided that it would be better for me to buy it privately. And by this time, the system is kind of balanced out. Providers or insurance companies have figured out a better way for tax credits and premiums and all that. And I was able to get a really affordable, relatively pretty good plan. My plan was $400 a month, $480 a month. And then with tax credits, it brought it down to about $100, which was wonderful, very affordable, and I get pretty good coverage. But going into next year, my salary is going to bump up. My insurance is actually going to bump up. So the plan actually stayed very similar in cost between 2021 and 2022. And so when I had to update my financial information, they're like, okay, well, your tax credits might be less. And I was like, you know what? I expected that. I'm making more. So I've gone from paying about $100 to paying about $300. And for me, like I said, that's fine. I'm a single person. I don't have pets. I don't have a car payment. I'm still on my parents' car insurance. So for me, that's fine. But what if I had kids? What if I had debt? I'm also lucky that I don't have any student debt. What if I had all this other stuff? And all of that factors into your tax credits. That's the thing. It's so hard to tell what you're going to pay for insurance because all of that is included. So kind of walked through then how easy it is to lose your care, how expensive it can be, and how you have to look at it at an individual level because $300 for one person doesn't seem like a lot. But when you're making at a time when I was making maybe $26,000 a year, at my first job, I made less than, actually. I rounded up there. $26,000 a year, but your insurance, you're paying $300 a month. It's a lot.
It's so much.
It's so much.
Yeah.
And then, so another thing that we run into with insurance is and something Liz has talked about a lot, is the insurance companies get to dictate care, which someone who does not have a medical degree should not get to do.
Yeah, they should not.
And fun stuff, I've experienced that. Not in like a major way. I mean, like not like in a life or death way, but certainly in it's affecting my life up to this point way.
Mm-hmm.
So I've inherited our mother's bones and joints.
They're awful.
They're terrible. And I've had problems with my wrists. I mean, I did the whole thing. I went to primary care and they're like, okay, go see an orthopedist. And I went to see an orthopedist and we did all the things. We did the splinting and the medicine, blah, blah,
Which
blah.
is like normal.
Yeah,
That's
you
a
know, you did the normal
step.
things.
Mm-hmm.
And then we found out, okay, your ulna is too long. It's buttoned up into, oh yeah, this bone on the outside of your arm, your ulna. My ulna is too long, so it was buttoned up into my bones of my hand and causing lovely tears and erosion of my bones and ligaments and tendons. It was fun. And so my doctor was like, all right, look, we have, basically it's causing you chronic tendonitis and it's going to keep eating away at your bones and all that. So we have two options. We can do minimally invasive steroid injections and see if that helps, or we can do incredibly invasive surgery. I was like, I like the first option. I like that, minimally invasive. So I got a steroid injection in my wrist and it made everything 20 times worse. It was so bad. And it was in so much pain. It went from hurting to use my wrist to not being able to use my wrist. And so when I went back to the doctor, I was like, look, dude, this didn't work. And he's like, all right, well, the next step is surgery. So we have to go through insurance to see if they'll cover it. And so, you know, we tried, like I said, we tried everything else. And my doctor comes back and goes, insurance will not cover it until we've proven that a steroid injection doesn't work. And I'm like, dude, it doesn't work. We tried this already. And he said, yeah, but the insurance company is saying that it didn't count. Like, you have to do it X number of times. And so I had to get, I think, like three or four steroid injections that were incredibly painful and left me useless with my right hand for like weeks. Until they finally were like, okay, now you can do the surgery. And I was like, great, we're gonna have the surgery done. It's gonna, my life's gonna be better. Do the surgery. They shortened my ulna by 3 millimeters, and it's very invasive. So that this is relevant, I swear, but you might want to skip if you're a little squeamish. They cut through your
We
skin.
don't need to know.
No, you do. They do actually.
Okay.
They cut through your skin and they cut through your muscle and they saw through your bone.
I don't like ortho.
And then they put the bone back together with a metal rod and metal screws. And then they it's kind of funny. I still have a gap in my muscle here. But the thing is, you need extensive physical therapy after that because your muscles have been ripped out of your arm.
Mm-hmm.
See, this doesn't bother me. It bothers her. I watched a video of the surgery before I had it. And the thing was with my parents' insurance, I got all that physical therapy. I got, I think 12 appointments, and then I could go back for like follow-ups. And so my recovery after that surgery was great. My physical therapist was wonderful, and things were great for a while until I needed another surgery because metal in your arm grates away at things sometimes. So I had to have the hardware removed. I didn't need a lot of physical therapy after that. It was just kind of like, okay, go and do your little exercises. And life was good again. Until it wasn't. And I started having a lot of wrist pain again. Turns out my tendon had gotten frayed, which I didn't know was a thing. My tendon got frayed from all of this. And then there's a bit of tendon that goes around all of these bones in here to keep it in place called a tendon sheath. And mine ruptured, which I didn't know was a thing. And essentially I had chronic tendonitis for the rest of my life was kind of the prognosis. So I went to a pain specialist, and the pain specialist was like, we can reconstruct your tendon, which you can imagine is not fun. They take out the bad stuff, they rip out a piece of your muscle, and they make a tendon graft out of a piece of your muscle. So you can imagine you need a lot of physical therapy after that. My new insurance at this point would not let me do that. They said, you get 2 appointments. That's all we will cover after a very invasive muscle graft. And when I went to my occupational therapist, they were like, oh. Like, when I told them when they saw on the script how many appointments I got, their face just went, we are no longer focusing on, and this is what they told me. They said, we are no longer going to be focusing on occupational therapy during your occupational therapy appointments. I am going to teach you how to be an occupational therapist. Because that's essentially, they said, you get to appointments. I'm going to give you every single printout I can think of, and I'm going to teach you how to be your own therapist, because I don't get to do that for you. And we tried doing appeals. We tried like going to the insurance and being like, look, I need this because my arm is in a hard splint for months and then a soft splint. And so basically what that's led to is these people who sit behind desks and decide policy and have no medical training whatsoever. I mean, like I said, I don't want to be like dramatic and say it's changed my life, but it has. You know, I can't hold my nieces for more than a few minutes. When they were babies, I couldn't hold them. I would have to hold them with my left, and I was terrified I was going to drop them. I can't, nowadays, it hurts to pick them up. I can't play video games. I can't play piano. My hobbies that I love, like sewing and knitting, I do them anyway, even though it constantly hurts. Like, I can't knit or sew or type or play video games or even cook, wash dishes without being in pain. And I'm sick and tired of taking pain medication, so I don't. I can't live off of Advil and Tylenol because I enjoy my internal organs functioning and I enjoy not having ulcers. And so it's just like, it's a small thing you think about, like, oh, occupational therapy post-op, but then it's like, I have lifelong repercussions from that.
Mm-hmm. And I have tons. I mean, I see that all the time.
Yeah,
patients who just, you're like, oh, this is the best treatment that we are going, like, this is what would work for you. And then insurance is like, oh, but you actually have to try these other two things first. And, that's putting it at an even increased risk. And in that time, like, things are just getting worse. And it's a mess. So that's did that kind of touch on all of your experiences? Well, thank you for sharing them with us.
I'm sorry, I was tangential.
That's okay. It's genetic.
It is.
Yeah. So hopefully that just kind of gave you an example of how, like, this can happen to anyone. It's so easy to fall into the gap of, oh, you lost your insurance. You don't necessarily ever think it's going to happen to you either. Like, it affects everybody. And it's like, would you say it's a problem?
Yeah.
Yeah.
Oh yeah, it's a problem.
Yeah.
And like, I'm a minor example. If you were to look at the grand scheme of things, and like I said, comments and stuff on Liz's videos, me not being able to play piano without being in pain is so minor.
Yeah.
Compared to like, oh, we've tried all these things and now I can finally get the insurance to let me have the procedure I need to save my life. Oh, but it's taken a whole year, and so now we have to start over.
Or you're no longer eligible for it, and now it's going to kill you, or you can't afford, cancer treatment. Like, there are serious.
I'm a drop.
Yeah.
In a much larger bucket.
You were just our guinea pig. So.
And easily available.
Yeah.
Because.
Yes. So, thank you. I appreciate you. Would you like to shout out any of your social medias or anything?
I sew things.
She sew things. I'll leave the name right here. Da-ding!
I'm very inactive on there. I have 79 posts or something over 4 years.
Very into it, I can tell. This wraps up this video. Hopefully it gave you an idea of what some of the things are. Most of the ones going forward are going to be a little bit more technical and a very data-driven understanding, like what is everything. We just wanted to intersperse some other human stories. If you have a human story that you would like to share and you would be open to sharing it on video, I would love to do more interviews like this and just kind of sprinkle them throughout to get a taste of, hey, this is what's happening. So if you're comfortable sharing something like that on video and you want to do like a Zoom interview that I could record and put on here, I would love that.
Or you could just even do audio.
Yeah, or even audio. I would love that, just to kind of raise awareness for as many situations as we can to highlight that this is not working and figure out what we can do to fix it. So thanks for watching today. Make sure to subscribe if you want to see more of this deep dive series. I appreciate everybody who shared the last one. That was super duper cool to see kind of where it all went. So thanks. Thank you. I'm hungry.
Me
Let's
too.
go
I
eat.
will never be allowed back on because I talk too much.
Well, you're fine. That's why there's editing. Just tie it in a bow. All right. Thanks for watching. Bye.
Bye.
Interview with Rachel. Take 1.
Marker.
Hello.
Sorry.
All right. So that wraps up. You need to leave that in there.